Hello everyone, Sarve Janaha Sukhino Bhavantu. I am Dr. Anirudh Jagannath, practicing endoscopic skull-based neurosurgeon and pituitary gland surgeon with Aster Neurosciences at Aster RV Hospital, JP Nagar, Bangalore. Today I would like to talk about the pituitary gland and the tumors arising from the pituitary gland. Pituitary gland is a tiny gland located at the base of the skull behind the nose, and it is connected to the brain through a tiny thin leash of pituitary stalk. It's a mighty gland and it produces a lot of hormones, over 6 hormones, which are vital for the body functions. It helps in metabolism and body function. It helps in growth and development. It helps in lactation, childbirth, reproduction, and through a hormone called ADH, it also regulates the amount of urine we produce and saves the water for the body through kidneys. Any tumor arising from the pituitary gland is called a pituitary adenoma. They are very common tumors. In forensic studies, nearly 1 out of 6 autopsies had a small tumor in the pituitary gland. However, it is called as incidentalomas. Not everyone will be symptomatic for that. Nearly 1 in 1,000 suffer from effects of pituitary adenoma. Depending on the size, we call it a microadenoma if it is less than 10 millimeter in size, or a macroadenoma which is bigger than 10 millimeter in size. Sometimes these tumors produce excess of hormones, sometimes it does not cause any hormone excess. So based on the hormone that is increasing in the body, it can be a prolactinoma, wherein the hormone prolactin is excessively produced. It can be a Cushing's disease wherein the hormone ACTH is excessively produced, or it can be an growth hormone secreting adenoma wherein the growth hormone is excessively produced. The symptoms of pituitary tumor vary. Usually when the tumor grows in size and it grows up, as such the gland is located in close proximity to the nerve of the eye, what we call as optic nerve and optic chiasm. So it can press on these nerves and cause visual dysfunction. It can also press on the dura and cause headaches. There are also vital blood vessels on either side and the nerves on either side of the pituitary gland that can get compressed and cause various symptoms. Sometimes the hormone excess itself can cause effects on the body. A prolactinoma, in which there is a prolactin excess, can cause abnormal excessive lactation, that's breast milk secretion. It can cause menstrual abnormalities. It can cause loss of libido. In Cushing's disease, wherein the ACTH is excessively produced, it can cause abnormal body morphology. There can be a moon face, there can be a buffalo hump on the shoulder, there can be abnormal excessive truncal obesity, a non-healing ulcer, a young patient developing hypertension, developing diabetes, there can be abdominal striae. All these can be features of Cushing's syndrome. At the same time, if there is a growth hormone excess, the body grows too large with large spade-like hands, the foot becomes larger, the jaw can become bigger, and there can be malocclusion of the teeth, and this also can cause hypertension and diabetes in the adults. Diagnosing pituitary adenoma and treating it is very important to prevent morbidity and mortality. Now, so how are these tumors diagnosed? So somebody with a visual dysfunction usually visits an ophthalmologist who does all the tests to check for visual acuity and visual fields, and when a visual field defect is diagnosed, they will be referred to the neurosurgeon and the endocrinologist. We do an MRI of the brain and the pituitary tumor gets diagnosed. Sometimes these patients with hormone abnormalities meet an endocrinologist, and endocrinologists further evaluate these patients, and then a pituitary tumor is diagnosed. I would like to let you know that Aster Neurosciences, it's a center of excellence in skull-based endoscopic surgery. So I request anyone with these problems to consult at Aster Neurosciences, Bangalore. Thank you.